Sinusitis. Sinusitis is the inflammation of the sinuses. It is usually caused by a bacterial infection, but viruses and fungi can also be responsible. People with weak immune systems are more likely to develop bacterial or fungal sinus infections. Some individuals with allergies may develop a condition called allergic fungal sinus infection. Acute sinusitis typically lasts between 3 and 8 weeks. When the infection lasts longer than 8 weeks, it is considered chronic sinusitis. If not treated, a sinus infection can become serious and, in rare cases, may spread to the brain because the sinuses are located close to it. Normally, the sinuses are lined with mucus that traps dust, germs, and other particles in the air. Tiny hair-like structures sweep the mucus toward openings that lead to the back of the throat. From there, it moves down to the stomach. This natural drainage process helps protect the body. Sinus infection occurs when this normal flow of mucus is blocked. Infections or allergies can cause the small nasal tissues and hair-like structures to swell, trapping mucus inside the sinuses. Some people have structural problems that make them more prone to sinus infections. These include deformity of the bone between the two nasal passages, nasal polyps, and narrowed sinus openings. People with these conditions often suffer from chronic sinus infections. Common symptoms include post-nasal drip, greenish nasal discharge, nasal congestion or blockage, facial tenderness, especially under the eyes or at the bridge of the nose, frontal headache, tooth pain, cough, fever, fatigue, and bad breath. Sinus infection is sometimes confused with rhinitis, which refers to inflammation and irritation of the nasal passages. Rhinitis may be caused by a cold or allergies and only affects the nose. Allergies play a major role in chronic or seasonal rhinitis. During an allergic reaction, the nasal passages swell and become inflamed in response to triggers such as pollen, dust mites, molds, or pet dander. These allergens can cause symptoms throughout the year. Asthma is also linked to chronic sinus infections. Some people with long-term nasal inflammation or asthma may develop chronic sinusitis that is not caused by infection. Proper treatment of sinus infections can often improve asthma symptoms. Sinus infections may be diagnosed using CT scan, mucus culture, biopsy, etc. Treatment of sinusitis. Antibiotics are commonly used to treat bacterial sinus infections. The duration of treatment usually ranges from 3 to 28 days, depending on the type of antibiotic. Since the sinuses are located deep within the bones and have limited blood supply, longer treatment may be required in severe or long-lasting cases. Overusing or misusing antibiotics has led to increased antibiotic resistance. Therefore, antibiotics should only be considered if sinus symptoms, such as discolored nasal discharge, last more than 7 to 10 days. Antibiotics work by killing the bacteria causing the infection, but they may not relieve symptoms immediately. While waiting for them to take effect, over-the-counter medicines can help ease symptoms. Examples of antibiotics include amoxicillin, doxycycline, cefuroxime, levofloxacin. Nasal decongestant sprays are also used to sinusitis. Topical nasal decongestants can be helpful if used for not more than 3 to 4 days. They work by shrinking swollen nasal tissues, allowing better drainage from the sinuses. However, overuse can cause a rebound effect, where nasal passages become more swollen once the medication is stopped. Examples include oxymetazoline, xylometazoline, phenylephrine. Antihistamines. Antihistamines reduce inflammation caused by allergic reactions. They help relieve allergy symptoms that can lead to swollen nasal and sinus passages. Examples include hydroxyzine, promethazine, chlorpheniramine, diphenhydramine, combined decongestants, and antihistamines. Over-the-counter combination medications should be used carefully. Some contain drying agents that can thicken mucus. These should only be used under medical advice. Examples include loratadine, cetirizine, etc. Topical nasal corticosteroids. These prescription nasal sprays reduce inflammation and swelling in the nasal passages and sinus openings, the main problems in sinus infections. They can also shrink and prevent the return of nasal polyps. When used at normal doses, They are not absorbed significantly into the bloodstream and can be used long-term without causing dependence. Examples include fluticasone, mometasone, nasal saline washes. Saline rinses help clear thick mucus and secretions from the nasal passages. If medications fail, surgery may be recommended as a last option. It is usually performed by an ear, nose, and throat specialist. Surgery may correct structural problems, remove nasal polyps, and open blocked. This ends today's lesson. If you enjoy this lesson, please like and subscribe for more videos.